Yes, so as part of the universal health coverage agenda of leaving no one behind, most countries in our sub-region, in the African region, are increasingly having a greater population of people living older. So it's important to develop capacity of the health systems to be able to take care of their peculiar needs. As you're aware, the risk of cancer increases with age. So we are beginning to see an increasing prevalence of cancers in the African region. So the advanced courses will be an opportunity to place our healthcare sector in a unique position to be able to tackle this growing burden moving forward.
Perfect, thank you.
Yes, so the advanced course is targeting cancer care for older people. We're going to be having a much more increase in number of people that are getting older. Cancer is also an increasing burden in the African region because of one is people are getting older, two, the risk factors for cancers are becoming much more prevalent. Unhealthy habits like diet and tobacco use and things like that. So it's important that the courses prepare the healthcare workers on how to manage this burden. So how to communicate cancer, how to diagnose cancers in elderly people, what are the peculiar needs of older people in terms of care for cancer. So the course will line up because when we are supporting, there was a UN resolution in 2017 that urged member states to develop national cancer control programs. That's one. Two, in September this year, there was a World Health Assembly resolution on cancer in 2017. And this year, there was a UN resolution on universal health care. And the key to this universal health care is to make sure that no one is left behind. So tying the two together, we need to develop the capacity of the healthcare workers. And the SIOG Advanced Course is a unique opportunity to be able to integrate both. National Cancer Control Program, key here is human resource development. Primary health care and universal health coverage, human resources is a key component. So to be able to tie both together. So the session I was involved in, we were discussing universal health coverage in terms of, in relation to cancer care for the elderly. So there were presentations from PAHO, from European Cancer Society, I think. And we all looked at universal health coverage from different perspectives. Specifically, I looked at universal health coverage for cancer care within the perspective that most countries in the African region are at different spectrum of the cancer burden. Some are still dealing with non-communicable diseases, but others have predominantly communicable diseases to deal with. And so, but the key thing that, the key thread that runs across all these countries is that people are getting older, so cancer burden is going to be on the increase. And I also discussed the WHO Regional Office priorities in terms of cancer care and NCDs in general, looking at the WHO package of essential NCD interventions. It's called PEN, which strengthens the primary health care services to ensure that people access care, both prevention, diagnostics and treatment care services, closer to where they reside, and also to strengthen the referral mechanisms across from primary to secondary and tertiary. Yeah, so the key takeaways for me is that across all the presenters, one was that moving forward, low and middle income countries are going to contribute much more to the increasing population of older people. That's one. Two, cancer is a disease that increases with the older people. And three, we need to strengthen health systems to be able to tackle this challenge now and also to prepare for the future. Those are the key takeaways for me. There was also something about ensuring that human resource, especially in developing countries, adequate human resources are trained. One, training for human resource, and retention of these trained human resource. Those are the key takeaways. But I think it was a great opportunity to bring people and flag this issue as of aging population, which is one of the consequences of having better healthcare, having better socioeconomic development. But we really need to plan for what are the consequences, what this thing will result in.